I'm Mark McAllister inside the Toronto Public Health offices, and as you can see, I'm wearing a mask because of the protocols that have been put in place here. We're here because we're talking with the medical officer of health, Dr. Eileen de Villa, who has been part of our newscasts on a daily basis from a press conference, but now you get to show us what actually takes place here in this building. First of all, maybe explain the masks and why we're wearing them.
Yeah, so we're wearing these masks right now here in this building of ours because we have members, our staff members are members of our community, and COVID-19 is in fact affecting our community. So our local community here in the building was also affected by COVID-19. And in order to protect those of us who still need to be here and need to continue to provide this valuable public health response to COVID-19, this is a protective measure that we're taking to ensure that we're not furthering the transmission of COVID-19 here in our community in this building.
How many confirmed cases have you had among your colleagues here in this building specifically?
So in this building specifically, we had 10 colleagues directly impacted by COVID-19.
And as a result, I would assume that there's quite a few people that would normally work here that are in isolation or working from home now?
That's right. So we do have some people who are doing work-home isolation, some who have become sick and are therefore in isolation, and others who are working from home where that's possible. All this in order to make sure that we're able to provide our important public health response while at the same time protecting the health of our staff.
Last month, there was a number of concerns that had been brought forward, some from the employees here in this building about the conditions that were put in place when all this began, whether or not it was a safe workplace environment. Maybe just explain to us what things were like when this all began and maybe some of the changes that have taken place since.
Well, I think when we look at COVID-19, and as you've heard me speak over the last several weeks, there has been an evolving science and an evolving understanding as to, one, what our situation here is in the city, and two, an evolving understanding around how COVID-19 is transmitted. We're learning more and more about that every day. And when we talk about case and contact management, one of the key elements of the public health response to any infectious disease, it's work that's done in groups of people. Not always easy to be done in isolation or with physical distancing. We now know that there is such a thing as asymptomatic transmission in the case of COVID-19. So we've altered our practices because, of course, health and safety of our community and health and safety of the staff here providing the response is our top priority at Toronto Public Health. So as you can see, we've put some safety measures into place, including the use of masks for now, and we're trying to make sure that physical distancing and all the other public health measures to help minimize spread are in place here. We have active screening at our front door, lots of hand sanitizer and ability to use hand washing or soap and water, that kind of thing. These are all available so that we can try to minimize transmission.
We do have to wrap things up. Maybe very quickly explain what's happening inside this room right now.
So inside this room, this is one of the places that we have staff working on our case and contact management. This is the process by which we understand who are the cases of COVID-19, who might they have exposed to their disease while they were infectious, so that we can contain disease as early as possible. One of the key elements of our public health response.
Thank you for taking the time to do this. I appreciate it.
Thank you for being here.
Dr. de Villa, normally we see you on a daily basis alongside Mayor John Tory and Fire Chief Matthew Pegg. Tomorrow, of course, is Good Friday. They will not be providing the daily update, and we will hear from them again on Monday.